Gender-based medicine assignment. Oh, hi Homer, how's your day?
Oh, hi, E.T. It's okay. I just went to the hospital for some tests, and there was just something on the form I had to fill out that I found confusing.
Is everything okay? What is it that you found confusing?
Yes, everything's okay with me. What confused me on the form was the part that it was asking me about my sex and my gender. I am so used to seeing male or female, but this form had male or female under sex and under gender. Was man, woman, transgender, non binary, non conforming, and prefer not to respond. You work in the medical field. Why did they have to change that?
Well, I can help you with that. To understand it easier, let me tell you the difference between sex and gender.
They are the same.
No, they're not the same. Sex is determined at birth. Chromosomes, gonads, and anatomy determines a person's sex. Like for example, a female person is typically with two X sex chromosomes, ovaries, and then the hormones estrogen and progestogen. Also, they have a uterus, vagina, and a vulva. You know, women have breast and hourglass figure, more body fat, and higher pitched voice. And then a male person has an X and a Y chromosome, a testes, the hormone testosterone, a penis, and a scrotum. Also, they grow facial hair and they have a triangular figure, more muscle mass, and a lower pitched voice. But you know, medically, there are three possible sexes at birth. There's the male, female, and intersex.
Really? What is intersex?
Well, intersex is when a person that does not 100% fit the male or female sex description. This can be due to variations in their chromosomes, external genitalia, or reproductive system.
Wow. So, what is gender?
Well, gender is based on society and culture. Gender is not predetermined on sex. Our society expects people to fit into certain gender traits and roles. Like a woman must be feminine and a man must be masculine. Gender identity is the most important determinant of gender. It is the internal sense of self that states a person's gender, regardless of what the person's sex is at birth. That is why on the form you were asked to fill out, it had man, woman, non binary, and transgender. A non binary person feels that their gender identity does not align with man or woman, like a cis and cisgender. That term is used to describe a person whose gender identity aligns with the assumptions that their culture makes about members of their sex. Example, a person who's assigned a female at birth and identifies as female is considered as cis. A trans or transgender, that person's identity does not match the assumed characteristic of their assigned sex. Like example is a person who was assigned male at birth might feel that their identity to their self is aligned more closely with female identity. But nowadays, you know, people can get surgery to have their sex anatomy changed.
I get it. But why do they have to know all these when a person goes to the hospital for a test or procedure?
Well, you see, Homer, it's very important for a person to disclose to their healthcare provider their sex and gender. because it is important that the healthcare providers are respectful to avoid any discrimination based on sex. But most importantly, it's important because for the proper medical treatment of the person. Like, let's say, for example, a patient who was having a heart condition called atrial fibrillation. He comes in into the emergency room whose gender identity is a man. But it's very important that this patient disclose the biological sex is female to avoid any errors in treating the problem. You see, a female is at a higher risk for stroke, most likely hemorrhagic stroke. Also, females have higher risk from antiarrhythmic drugs such as digoxin toxicity and long QT syndrome. Can you just imagine if the patient's biological sex was not disclosed and the doses and treatments will be based on treating a man when actually the sex at birth was a female? That could cause some serious conditions.
Oh, yeah. You're right, E.T.
Well, healthcare organizations are modifying policies and procedures to avoid discrimination based on gender. Also, healthcare staffs are being trained on how to treat patients of different gender identity. The American Medical Association have new policies and they have trainings for medical professionals regarding advancing gender equity in medicine. This is why you were asked that question on that hospital form.
Thanks, E.T. Now I get it.
You're welcome. The
Bye.
end.
Bye.
Bye.